Your croup picture, cleft lip, cleft palate. You know, this is a really popular little deal on the test.
That's right. That's Sunday we talked about I went to work. Remember I told you that medicine
Yeah.
that they had to give a little
Oh, racemic epi.
Yup, remember I said you see?
Yeah.
Crazy.
So Essence said when we got done talking about croup last week and racemic epi, and I told y'all don't fall for it on the test. Epiglottitis is not treated with racemic epi. And she went to work and she saw them using racemic epi right at work.
No,
it was
I
part of
had
the
to give
orders.
it. I had to give it.
The inhaler.
Yup,
Yeah.
the little boy, he was 22 months old.
Oh.
And it sounds crazy.
Croup is horrible.
I was like, I didn't think he was gonna make it the way he was sounding.
He does.
And
They
he
sound
had
worse.
to do it 4 times. We had to give him 4 times.
Yeah.
Crazy.
All right, now you might see a child with cleft lip or cleft palate or both. Raise your hand if you have. Anybody? Now look around the room because I'm pointing something out. Raise your hands real high if you know a kid. So what is that going to be on your test, what you just saw? It's common. That's how I get you to see how common. I asked you to look around the room. Everybody's hand up, it's common. That's first on your little case study.
Is that hereditary?
We'll find out. I'm going to answer every question you ever could ask. Okay, now, so number 1, it is common. It is congenital, which means they're born with it. It is congenital, which means they are born with it. The cleft lip runs in the family, and the cleft palate is genetic. I'll say those 2 different things again. The cleft lip runs in the family, much like high blood pressure runs in the family, but it's not genetic. Cleft palate is actually genetic. So you're going to see some genetic defects that go with the palate, but not genetic defects that go with the lip. So if the person has a cleft lip, you don't need to worry about, oh God, what other genetic problems do they have? But if they have a cleft palate, you better look for more genetic problems. Okay, that's how that's supposed to flow in your language there. Okay, now let's talk about risk factors. Once upon a time, I've told you guys there's one big risk factor that is responsible for the majority of defects, especially GI or cardiac. And this is the mouth, so it's GI. What did I tell you that risk factor was? Not alcohol, drinking, and pregnancy. No.
Smoking?
Nope. Told you it's number 1 with birth defects. Yes, I've often told you guys there is a number 1 risk factor in pregnancy that is just number 1 for birth defects, especially cardiac and GI, and the mouth is GI. Anybody remember? That's going to play a role, but
Drugs.
diabetes. Number 1. No, I don't know how you missed it. So yes, beloved, diabetes. And I say that the way I said it because you rarely get it right. So I'm going to keep saying as much as I can. Diabetes is a number 1 risk factor for all birth defects. Number 1 for all birth defects, especially cardiac and GI. Number 1. Okay, so anybody with either diabetes before they got pregnant, which I'm answering your question now, if you listen, I was answering her question while she was asking you. That's what's so funny. So if you are a diabetic before you ever got pregnant, or you are a diabetic just in pregnancy, what is that called? Gestational. Either one, birth defects. Okay? Okay, so that's important because you have to think that through. Now let's deal with the other risk factors for specifically cleft lip and cleft palate, not just cardiac and GI defects. Specifically, I like what you said. folic acid deficiency. You know you got to know that. Risk factors for cleft lip and palate, other than diabetes being number one, folic acid deficiency. What vitamin is that? No, it's not B1. B9. Yes. So what is B1?
Thiamine.
We're going to do all our B vitamins now that we up that street down that alley.
Thiamine.
Thiamine. Who is it for? Alcoholics. What does it prevent? Wernicke-Korsakoff syndrome. Excellent. B2, you don't give a shit. It's riboflavin. B3, you do give a shit. What is it?
Folic acid.
No. What is it, y'all? Niacin. And it is for cholesterol. It is for high cholesterol. B6, what is it? Don't look. Don't do it yet. Don't do it yet. What is B6?
Wait, don't say it.
Okay, starts with a P. Pyridoxine. What is it for? Yes, who said that? Yes. Prevent neuropathy with patients on TB meds. B9 we said was folic acid or folate. What does it do? Prevent neural tube defects. All right, see, this is a neural tube defect too because it's in the cranium. Okay, so then that's B9. B12, what is it?
Cobalamin.
Cobalamin, yes. What does it do?
Now you went too far.
What is it? Okay, so let's deal with what it is a deficiency. If you have a deficiency, what happens? Stomach cancer, dementia, and neuropathy. So again, B12 deficiency, dementia, neuropathy, and what was the third one? Stomach cancer. You're missing the intrinsic factor. Okay, B12 is very needed for metabolism. See, this is what I want you to say to yourself on the test. Mostly all B vitamins are neurovitamins. They do something with your nervous system and prevent neuropathies. That's the most important take-home message, right? Okay, so let's go now. Let's go. We have a patient who could have had a mom who is diabetic. They could have had a B9 or folic acid deficiency. Mom could be a smoker. Somebody mentioned that earlier. It's not number one, but it is a risk factor. So mom could have been a smoker. And then we have to worry about the medications that mom might have been on, because I had one of my patients on this medication. I'm so damn glad I stopped her from taking it, and she saw me early in the pregnancy. Seeing people later in the pregnancy is why we're seeing more an increase in some of these congenital defects, because if we can catch you between for the most part, if we can catch you between week 4 and 6, which is when most women do a pregnancy test and get a positive, and we can ask you what meds are you taking and stop them, we can prevent the birth defects in the first place. So what kind of meds are giving these patients these type of birth defects? Get ready. It's not what you think. Zofran, which is called ondansetron. We used to give it to all kinds of hyperemesis gravidarum patients. Zofran or ondansetron. Let's put on the board because you have to know how to spell it, beloved.
These are the methods that mess up my heart situation.
Yeah, ondansetron. Now listen, everybody. If you see anything on your test ending in cetron, it's an antiemetic. Anything on your test, granisetron is Kytril, Zofran is this. Okay, so yes, ondansetron, yes. Here's another one. The generic name, which I prefer you know, but you may know the brand name just by being common drug. Valproic acid. What is the brand name? Depakote. Very nice. So valproic acid, which is Depakote. Very nice. You know this one, methotrexate. Everybody knows that's a teratogen.
Yeah. Hey, the difficult word.
Depakote? Who said that? She is so funny. Depakote word, girl. That's what it is. Depacote. Depakote. Depakote. Yeah, Kote. Depakote. Okay, here's another last drug for you because it's so common. The ones I'm giving you are very common, by the way. Topiramate. 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 I don't know. I wouldn't say that. I don't know. Topiramate, it might be, but I don't know. Here's what I know about it because it's very common and I give it a lot. It's for migraines.
I think it's topiramate. I knew it was for migraines.
Oh, good. And then the other thing they use topiramate for is to ease your transition off drugs. Yep. Okay, topiramate. So those are the risk factors. Now, let's talk about the complications because sometimes y'all confuse these words. Complications. And yes, you do have certain complications. You see more with cleft palate than you do cleft lip. So I want you to make sure you know cleft palate is more serious. Cleft palate is more serious. Oh God, yes. Yes, you can have the lips without the palate and the palate without the lips. Or you could be all the way screwed and have both. Okay, so here you go. Complications, right? The number one is deadly, right? It's aspiration pneumonia. You aspirate, you can die. You knew that. So aspiration pneumonia. That's with both. With the palate, frequent ear infections. And because it's frequent ear infections, this patient may be deaf after a while, hearing loss. Remember, that's a complication of frequent ear infections, hearing loss.
And that's more with the palate, you said.
That's more with palate. Okay, let's take it a step further. Speech difficulties, because you form your words with your palate as well. Tongue to the palate to do different speech. So speech difficulties, especially with the palate. Dental problems with the lip. With the cleft lip, you're going to have dental problems. Now, our issue with cleft lip and palate, because I did deliver a baby with this, our issue with the cleft lip and palate is they are not going to get surgically operated on right away. Nope, nowhere near newborn stage. It's too much of a risk to operate on a newborn. This is more cosmetic than anything, as well as issues with, language. So we wait. Now the key is don't wait too long where language development has already started profoundly. So this is what we do for the lip because that's not a language issue. With the lip, that's the earlier surgery. 3 to 5 months of age, 4 months being average, but 3 to 5 months is for the lip to be repaired, surgically repaired.
You said 4 to what?
4 to 6 months. I mean, no, I didn't. I said 3 to 5. Yeah, you're fucking me up here. Okay, so 3 to 5 months. 4 is average. 4 months is the average age. So that's not going to impact anything because lips don't anyway, except for teething, okay? Now let's do the palate, which is a big deal. The palate is the one with all these other problems, right? So that's going to be surgically operated on right before language development, somewhere between 6 and 12 months, with average being 9 months of age. The key is before that kiddo turns a year, they need to have operated on this. Now, you guys got to know this word. When the test asks you crap like this, this patient needs a multidisciplinary approach. This child needs a multidisciplinary approach. Here's what they mean, and I'm going to give you all of them because you kind of got to know this. Nutritionist, surgeon. Hope you ain't looking at me. I hope you're writing. So nutritionist, surgeon, dentist, speech pathologist, plastic surgeon, audiologist, A-U-D-I-O, audiologist, for hearing, because they have a lot of hearing loss if they can't, from the ear infections. Social worker, because a lot of what happens is expensive. So social worker. Case manager, which is always an RN. Case manager, which is always an RN. Remember that these children, like any other child with a birth defect or disability, are at risk for abuse. When surgery is done, they will come out of the OR. Quote me on this. When surgery is done, they will come out of the OR with elbow restraints, not wrist restraints. They're going to come out of that OR with elbow restraints. This child needs to be fed sitting up. The palate, the cleft palate should not breastfeed, but should drink breast milk. Don't get it twisted. Just because they can't breastfeed doesn't mean a damn thing about the milk itself. So pump and feed. This is a cleft palate that will have lots of trouble trying to breastfeed, but they need breast milk. The cleft lip should breastfeed. They have less aspiration risk when they breastfeed. No pacifiers with this baby. No straws. They will need special nipples. They will need frequent burping. Frequent burping. We must feed this child slowly. And we are looking at 3 measurements of success. 3 measurements of success. Weight gain. Wet diapers. How many in a day for a new baby?
8 to 12.
6 to 10. Yeah, 6 to 10 wet diapers in a day. And feeding difficulties like coughing and choking and all this nonsense. The reason why you have ear infections with cleft palate is because the cleft palate affects the eustachian tube. I'm going to write that word down because you do have to know that word on the test. Eustachian tube. Let's hope that's about right.
What did you say about it?
The palate, the soft palate is attached to the eustachian tube. And when you have a cleft palate, it's no longer attached. So they get ear infections.
Can you tell me what was the third measure of success?
Wet diapers, weight gain, and feeding difficulties. Now, the way we check for this in the newborn period, even labor and delivery nurses check for it. We put a glove on our hand and we stick this finger in the child's mouth, and the reflex is to suck. We are taking this hand that we just put in this child's mouth, and we're taking our finger like this, and we're touching the palate as they're sucking, making sure there's no hole. Because you could have a perfectly looking baby with a cleft palate and not even know it if you don't get that strong suck. And then you're palpating the palate, right? So you kind of got to know that's how we do it in the labor and delivery suite. And then the newborn nursery is going to check again. The patients with the cleft palate have a poor suction and seal. You will know it immediately. Okay, and like I said, it can be missed. The baby with the cleft lip, this is what you do when they're feeding. Squeeze their cheeks. Squeeze their cheeks. Lastly, post-op. This baby needs petroleum jelly put all over the area. They need to be sedated so they don't cry or they'll pop stitches and whatever else. So I'm going to say that again. Petroleum jelly to prevent crust formation, which will cause scarring. Petroleum jelly, which will prevent crust formation, which is actually written on your paper. And crust formation causes scarring. They will need to be fed with a syringe or a dropper. They cannot suck at all, or they're going to do their mouth like this and break every stitch and everything. So no sucking at all when they're post-op. You need to feed them with a syringe or a dropper.
This was lip or palate?
Lip or palate. Post-op. This is post-op care. You are trying to make sure, again, this is very popular wording, there's no crust formation along the suture line. No crust formation along the suture line. This is more common in males, although the baby I delivered was a female. That's on your handout. Now, so this is how it went when I was delivering this baby, because diagnosis, please put it down on your paper. Diagnosis is typically done when you're pregnant, 18 to 20 weeks with a 3D ultrasound. They didn't have 3D ultrasound when I first started delivering babies.
You said how many weeks?
18 to 20 is on your test for anatomy scan. They call it an anatomy scan. 18 to 20 weeks. Ultrasound in pregnancy is called an anatomy scan, and this is usually when we see it because you get a 3D ultrasound. We've all seen it by now, what 3D looks like. But when I first started delivering babies, they didn't use that all the time. Only certain people knew how. So this baby that I'm delivering, remember how you deliver a baby? Head first. So the head is coming down. Remember how babies come out of their mommies 90% of the time. Some don't get the memo and they come out backwards. But most of the time, every time she pushes, you'll see this head. And then it'll get really big and it'll be all the way around, and that's called crowning. This is all you're gonna see. That's crowning. It means that the baby's out and didn't go back. Okay? So now this head is gonna do this. Watch. It's gonna do this, and I'm gonna see the nose, the bridge of the nose, and then the mouth, and that's what I saw. So I'm looking at this baby because I'm delivering the baby. So I'm going like this, and the head is going like that, and I'm turning the baby, and I'm like, okay, we have a major problem. Because what can happen at birth? Aspiration. So I'm like, bulb suction, we're a little wet. We have little codes we say so mom doesn't worry. We're a little wet. That's like hint, hint. Bring me everything, child. Okay, so the nurse is going to bring me everything I need to suction before I even take this body out, and they take that big deep breath and aspirate. Okay, now I got to figure out how to give her this kid, because I believe in giving you your own child. Because now we have a really, like, a hand grenade was thrown in the face, right? So she was so shocked, and every mother would be, right? And here's what I told you that's on the test, and I hope you remember. She's going to go home with that baby. And there are people that are so fucking cruel. And they're going to say dumb shit to her about her baby. Everyone wants to feel like they have a pretty baby. That's just facts. She's going to go home. This is going to be like torture for her. And we're not going to do anything with this baby for 3 months or more. So we've got to help her try to cope with this baby. So don't forget, that's why psychology might be involved, social worker for sure. Okay, babies, if you want to get checked off, show me your goods.